Okay, so Mike, for the last year, you've been working on a public health project that is related to children and adolescent mental health.
Mhm.
Can you tell me a little bit about that project?
Sure. So it's focused in particular in Jerome, where I'm at right now doing some clinical work with suicide, suicide prevention, intervention, particularly for teachers and those who are around kids often.
Of all the public health issues, why are you focusing on child and adolescent suicide?
It is a real tragedy when a child dies by suicide because there is so much lost potential there. A kid who dies by suicide could have gone on to make a huge impact in their community, make a huge impact in Idaho, heck, even make a huge impact in the United States in general. We'll never know what they could have done because of the pain that they were suffering and the only way that they saw out.
What can you tell me about suicide on a national and on a statewide level?
For those who are 10 to 35, suicide is the second leading cause of death, right behind accidents. And so, anything to help prevent that sort of thing is desperately needed. I don't want to do anything to downplay the efforts of Idaho, but multiple surveys and comparisons put Idaho near the last. So not having access to the proper mental health care is definitely a big risk factor when it comes to suicide rates. The doctors and the residents that I work with, their patient panel half the time will be mental health concerns that patients have. And these are family practice docs who have a broad base of knowledge, but don't have that specialty insight and years of training that a psychiatrist might have.
And so for the past year, you have been working on this particular project in Jerome. Can you tell me some of the specifics around it?
Sure. So it is to train as many individuals in Jerome School District in what's called QPR, which is question, persuade, refer. When someone is showing suicidal behaviors or mentions that they want to die, QPR allows the person who's there for them to be able to question and find out more, persuade them to seek out that professional help, and then go with that person basically and refer them to that help. And it's not meant to solve the problem then and there, but it's meant to provide some stability until a trained professional can intervene.
How's the response been with the schools?
Better than I could have expected. They desperately want that sort of thing because mental health concerns usually present themselves for the first time in a school system.
So ultimately, what are you hoping to accomplish with this project?
I mean, at least for this year, I'd like to get as many people trained as we can. Next year, spread it to other rural communities and even urban communities. And then for me, long term, I'd love to be the person that those using QPR can refer to and just be able to help prevent as many suicides as I can.